Okay, so this is what we're all here to talk about is the campus coordination plan. And first of all, a big shout out to everyone who helped build this plan. It was constructed by the Occupational Health and Safety Committee and by some subgroup of that, um, and was also assembled with the help of the president and the senior administration team. So thank you to everyone, and also thank you to everyone who's done so much work on all of the individual unit plans, the department and program plans. That was really important to creating this plan. However, having said that, today is July 15th, 2020, and as we all know, COVID changes quickly. And so the information in this is only good as of today. Things may change in the future. And if you are someone in the future looking at this presentation, please take note that you really should look at the most current plans because this information may be incorrect in the future. Well, without further ado, I just want to start by asking the question, why did we even do any of this safety planning? And a big portion of us at the beginning of this whole pandemic went and worked from home. And that was because that was, deemed with the limited knowledge we had about COVID, the most safe thing that we could do. Obviously, working from home has posed its challenges and has its own risks, but in terms of the campus, it has kept most of us apart from each other, which has reduced the likelihood that we would transmit COVID. However, we have a sort of like a red line barrier there. If you imagine that, that is a safety obstacle, which the planning process has allowed us to overcome, so that now we do have people working on campus again in some limited capacities. And we're having people recording lectures, and there's been even some small meetings. So for example, the facilities management group right now is all back to regular operations. We do have occasional small meetings, all of which were made possible because we did the safety planning necessary to prove to ourselves and to the province that we could operate safely while in the middle of a pandemic. So the next big line that's coming up is residence. And all of us have heard and know that residence is opening. That is a big, big, big deal. And there is going to need to be a tremendous amount of further safety planning needed so that we can have people living here. They're going to need to eat and sleep. And as we all know, those things get kind of complicated with COVID, especially when people are all together, living together. So the safety planning allows us to get through these barriers, and then there are further barriers coming. So we have other elements of our community like athletics or the choir or the chapel who also have needs. And obviously our ability to operate requires us to, starting from working from home, slowly transmitting ourselves across line by line to get to eventually ongoing incremental increases to the campus's activity. And I think it's really important for all of us to understand that the way in which we progress through this is incremental. And if we can get the first step right, which is right here where we are now, making sure we're starting to work on campus, recording lectures, small meetings, then we can get ourselves to the point where we have people in residence and they're here living safely and happily, free from COVID, which allows us then to continue to move on to other items and basically bring this campus to greater levels of its original operations. And safety planning is the mechanism to do that. So while all of us are doing all these individual safety plans, really what we're doing is we're jumping over these red line hurdles, trying to get us closer and closer to, to the kind of university that we all know and love and want to return to at some point in the future. So the process has been pretty straightforward. It started with unit planning, so that's departments and programs. Everyone's putting together their own safety plans. And then we did a central coordination of these plans, which is what we're going to go through today. And then we're also now into safety plan implementation. So this is where in many of your individual plans, you wanted to maybe have plexiglass barriers, or maybe there was elements of the physical space that need to be altered. We're starting to do that now. And last but not least, we're going to have to do continuous monitoring and improvement, especially as conditions change around COVID. So the documents that have been generated on the left here are a list of all the different individual, units or departments or programs that contributed an individual safety plan. And what we've done now then is we've added to this the campus coordination plan, and that's sort of the glue that binds all of these individual plans together. And all good safety planning requires that basically the people who are doing the work are involved in the planning process. my experience is in construction safety, and there's a real emphasis on you need to get the workers who are actually doing the construction work involved in planning for their own safety. If you can do that, it tends to be very effective. And so the reason for us then doing all the individual plans was an acknowledgement that maybe the library may approach COVID planning different than residents, and that might be different from the foundation year program's approach to how they're going to manage COVID safety. And it's okay for us to have differences between us, but we do also need to have some central coordination of all of our activities, especially in common areas where we all have to live and breathe together. So the purpose of today is to go over that campus coordination plan, and you can find it on the website. Here at UKing's Coronavirus Faculty Staff. Also, you should be able to get this plan from the leader of whatever group you belong to at the university, or from your Occupational Health and Safety Committee representative. And we've been working hard. I know the committee's been really diligent about working together on this, and has worked really seamlessly. I have to give a lot of kudos to that. Having worked in other institutions with other occupational health and safety committees, King's is really exceptional, and we've done a really great job here to come together. So if you can, if you know who your occupational health and safety representative is, that's really the person that you need to be working with to communicate any concerns you have or any changes or improvements you might see, so that then they go up to the broader community and we can all sort of share in the knowledge. There's also other safety resources out there, obviously. The King's website, the Dalhousie website's also good. They have a whole safety department. I think they have 7 people actually working there. And so they've got lots of good and detailed information. Also, if your work happens to have association with Dalhousie, you're probably going to need to read that as well to know what Dalhousie's doing. And of course, last but not least, the Nova Scotia government website is our source for all things regulatory. And in many ways provides us with our real ongoing guidance. So again, keeping an eye on that webpage is essential. And if you have time, or if you are in the role of having to train others, there's also a really good video that Dalhousie's produced. It is Dalhousie centric in the sense that they're using Dalhousie buildings, but it's actually really kind of a cute, entertaining. They tried to make it fun, talking about COVID-19 and returning to campus, and it has all the basics about how to wash your hands correctly, how to social distance. All of the basics are in here. It's about half an hour long, and it's well done. So if you're interested, and again, just take it with a grain of salt. This is Dalhousie, it's not King's, so not everything that they talk about is relevant to us, but as a general primer for anyone who's maybe wants just the basics, it's a good resource. Okay, so let's get into the actual campus coordination plan. So here's the key sections. I have organized these slightly different than the actual document just to make this webinar flow a little better. But if you try to follow along, you're going to have to jump along a little bit in the document. But these are basically the 9 major categories I'm going to look at: training, communication, continuous improvement, general requirements, which is like hand washing and that sort of thing, de-densification of the campus, a word we all didn't know existed until now, de-densification, which obviously means separating people, gatherings, building circulation, that's going to be big, common spaces and washrooms, physical barriers, contact tracing and communication of the COVID-19 infection. So what do we do here if COVID gets close to our campus? And last but not least, of course, is our accountability to ourselves and to each other to follow the plan. So the first one I want to talk about is safety training, communication, and continuous improvement. Above all else, this is probably the one aspect that is going to differentiate us in terms of whether or not we're really successful in battling this pandemic or not. It is great to have plans, and having really perfect plans are wonderful. But if the people who actually are supposed to be following plans don't know about them, if they're not participating in them, and if they're not discussing them on a regular basis, they often just go up on the shelf and get forgotten. And in many ways, most plans are really imperfect, no matter how much graphic design you put in them to make them look pretty. They're all imperfect. They all need to be improved. And usually the people who are doing the work themselves know best when something's wrong. So if you learn nothing else from this webinar, please pay attention to this one slide. We need to be good at communicating. So that means obviously talking to each other about plans like what we're doing right now. Everyone in the community needs to be trained. and everyone needs to sign off on the plan. So what that means is each of the groups, the units, the departments, programs are all going to have separate training for their staff in the specific plan of their own, and in also this common plan, the coordination plan. And then everyone needs to sign off on that they've understood it and that they agree to follow it. The reason for the sign off is that it really cements to everyone the importance that we take in safety, and that we really do need to follow this. You know, the icon on this page is those hands together, and that's because unlike any other time, our safety really depends on other people. I'm not safe unless you behave safely. You're not safe unless I behave safely. And so we all truly are interdependent um, in this endeavor of moving forward with a pandemic on our hands. And our ability to work together and to all agree to a common goal is going to be really critical in our success. And then last but not least at all is participating in regular safety meetings like this one. I'm happy to see so many people showed up for this webinar. It is key that we all have continuous conversations about safety. And I know you probably have 100 meetings already on your docket and you're Zoom fatigued or Microsoft Team fatigued, whatever. But you will find, and as I have found, that safety meetings are not nearly as boring as they sound. So and you might actually enjoy them. So 3 things need to be spoken of at a safety meeting. First of all, you need to talk about incidents and near misses. And what this means is like, did someone see something that maybe we could have done better? Or I noticed there was this one spot that we were trying to social distance, but it was impossible. Is there some way we could fix this? And then you begin to have a conversation among the group about how you solve those common problems, incidents or near misses. And this has 2 big functions. First of all, is people tend to come up with better solutions when they work as a team on common problems. And secondly, it helps to normalize the groups. So right now, probably in your individual, team, you probably have some people who may be very risk adverse. You know, that COVID is very frightening, and they are anxious, and the whole idea of coming back to a campus is very disturbing. You may have other people on your team who are the opposite, who maybe think that COVID is not a big deal, that really they'll be fine, everything's great. You know, why is everyone making such a big deal about it? When those people get in a room together and they start to talk out common problems, it helps them come a little bit closer together in understanding. Because if I know that one of my colleagues, maybe I'm, not that upset with COVID and I think that I'm safe, but I see that one of my colleagues is really quite frightened and needs some support. And part of the support I can give is the way in which I behave in the space to ensure that we have good, COVID-19 social distancing, for example. I might be more inclined to do that having had that interaction in a meeting with that person. And conversely, when people who maybe are very nervous see that everyone else is taking safety really seriously, that we are truly putting in plans in place, and that their colleagues are working towards their own safety and best interests, it encourages them to participate and be able to feel like, okay, this is a serious safety plan. We can really, put some trust in it. So that's a big part of what happens in those safety meetings, is the normalization of the group so that everyone begins to be more comfortable with the decisions that get made around safety. And then, of course, also talking about new information, and you should always talk about how you resolved past items. So this slide here is the most important slide of all. If we do this well, even if our plans have flaws in them, we'll find them, we'll fix them, and it'll be okay. This is where I can't stress it any harder, I guess, that we will stand or fall based on how well we do this item here. But having said that, recall that if you do have any issues trying to figure out, well, what should we talk about? How do we do safety planning? That there was the workbook we had. There were topics to talk about. I won't read them again, but you know what they were. And don't never forget about this hierarchy of controls, and trying to eliminate hazards as much as you possibly can. So in your discussions, things tend towards PPE, but really that's the lowest level. Try to think about ways in which you would eliminate or substitute. Well, in this case, it's not possible. Engineered controls like barriers to solve problems. And of course, I'm always available to help too if you need it. Okay, so the other thing we're talking about, general requirements. This is covered also in the document. So these are all the things that we all probably know about. So daily self-assessment, this is really important. Make sure that you don't come to work if you feel even the slightest bit sick. Call 811 and follow the recommendations of the health authority. Secondly, physical, social distancing. So this is the 6 feet. Hygiene, so washing our hands, as we're told, is one of the most important things we can possibly do to keep ourselves safe. There's also hand sanitizer, which is second best to that. And there's also the social hygiene, so, coughing into your arm and those items. We're going to have increased intensified cleaning, especially on touch surfaces. Personal protective equipment, I'll go into this a little bit more deeply, but this is the weakest level, but nonetheless, obviously one that we will have to engage in particular masks. And I will talk about that in the next slide. We also, as a group, decided that gloves would be somewhat discouraged because unless you have training in the use of gloves, you can misuse gloves and be under a false sense of security with them. If you ever look at medical professionals using gloves, they put the gloves on, they do one task, and they throw them out. If you're using gloves for personal protective purposes, you're going to be throwing out many, many, many pairs of gloves very quickly. And most of us aren't trained to do that, and we won't do that. So instead, it's not much help. Vulnerable populations, so these are for people who may have a very severe reaction to COVID or have an increased chance of that. So again, looking at if you are in that category, finding ways to further isolate and or avoid gatherings with others. And lastly, traveling. So again, the non-essential ban on university travel remains in effect. If you do have to travel for personal reasons, or if it is essential travel for university purposes, you need to follow all of the health authorities and public health recommendations, including any requirements to self-isolate. It's very important. So that one's straightforward. I think most of us are very used to those 7. Masks, right now masks are not mandatory, but I think we all see in the news how it is moving in that direction. So there's a provision in this plan for everyone to become prepared for the eventuality when masks may be made mandatory. And so obviously, if it's made mandatory, everyone who can wear masks will need to. And we will do our best right now to provide single-use disposable masks at the reception of the ANA. But the purpose of this really is to help people out who maybe forgot a mask or for some reason couldn't use it. We may have a limited supply. There is no guarantee that we will have enough masks. I did a calculation that said if we needed to provide a mask for every person on campus for the next 8 months, we would need 65,000 masks. So it is not entirely reasonable to expect the university will be able to provide that all the time to everyone. So we're really encouraging people to secure your own masks and reusable masks, obviously, if possible. Just remember that you have to clean them. And for that reason, I recommend buying more than one because it's a little bit inconvenient. If you have a couple masks on hand, you can buy them locally for about $7 each. Buy a few and then you can keep some in the wash and you always have a clean, reusable mask. De-densification of the campus. So this is about working from home for those of you who are able, and for those who need to do their work on campus, who are unable to do their work at home, it means working on campus. And so this is the sort of first way in which we solved the COVID safety problem, was to de-densify the campus. In other words, basically push most people out. And now we're bringing people back in, but we want to be careful about that. So working from home is still encouraged if you are able to do so, or you're able to do your job. And for those who can't, obviously having a safety plan in place is important. The maximum allowed density is 6 feet. That's just obvious. And gatherings are going to be something that we're going to need to have some control over. So in terms of gatherings, in the coordination plan, there are essentially 2 categories. There's gatherings of up to 10 people, so that's 10 or less, are discouraged, meaning that really if you can try and meet online, try to use the Microsoft Teams like we are now. But if it's truly unavoidable, then if you must meet, you need to make sure that you can follow all the safety requirements. So that includes the necessity for hygiene, social distancing, and highly recommended that you wear masks. And if you cannot social distance, you must wear a mask. So that's for gatherings of less than 10 people. For gatherings of more than 10 people, as of today, we are saying that basically no non-essential gatherings will be permitted. If there is a rationale for an essential gathering of greater than 10 people, you're going to need to write a safety plan for that specific gathering, and it will need to be reviewed by the Occupational Health and Safety Committee to make sure it's coordinated with everything else on campus and to make sure that everyone's aware that we are going to have a meeting of that sort. And they are all subject to approval by the president, meaning that even if you do have a perfectly safe plan, it still needs the president's approval before you'll be allowed to have that meeting. And if it's a performing arts or special event, it has additional requirements. So if you were thinking of doing something like that, you need to read the plan. I'm not going to go into all the details of that, but essentially you need to have additional ways to control the movement of people at the event so that social distancing is enforced. And again, you probably want to read the plan if you have any notions that might be something you want to do. In general, though, we really want to stay away from this, at least for now. And really only allow gatherings of up to 10 people with COVID-19 distancing in place. Building circulation. Okay, so this is a big one because everyone's going to notice this. Everyone's going to get annoyed by this. It's going to seem a little bit strange to have all these arrows and this door is in and that door is out. The reason for this is that the university by design is too small to social distance. It is not possible to have two-way traffic through any doorway on this campus and keep 6 feet apart. Having said that, it's also impossible due to the design of the campus for you only to have one way of travel and still be able to get to all the parts of the campus. So the arrows and the entries for the doors are there to let you know which way has the right of way to maintain physical distancing. And the entries and the way that they've been set up have been done so that you if you have a need for enhanced accessibility, you will be able to traverse the campus with the least amount of impediment. And I'm saying that very carefully because our campus is not fully accessible. So it will remain not fully accessible. But the reason why the arrows were chosen, the reason why the entrances and exits were chosen was so that someone who does have need for enhanced accessibility will still be able to use the maximum number of spaces possible given the accessibility that we currently have. Having said that, if you are in a corridor and two people are coming at each other and perhaps one person's going the wrong way and one person's going the right way down the corridor, you need to give way to the person who's going in the direction of the arrows. And part of the reason for that obviously is so that everyone knows who gives way to who, but also because some people with accessible, needs for enhanced accessibility, the need is not obvious. And they need to know that they will always be able to get to where they need to go without having to be forced closer than 6 feet to someone. So if you see someone coming towards the corridor and you're going the wrong way, remember that you are the one who has to turn around and go back. And the person traveling in the direction of the arrow is the one who has the right of way. So again, I talked about accessibility. The elevators is the other one. Really at this point, where the elevators are only large enough for one person at a time. The only exception would be for support workers who might be helping someone who needs enhanced accessibility. Isolation and quarantine space. So the university does not have a specific quarantine space. Instead, if you suddenly feel ill in the middle of the day, the plan is you need to stay put wherever you are. Don't move around the campus any further. Find a way to get home and exit the campus in the most immediate way that you possibly can. And that's to minimize the possibility that if you do have COVID, that you're not moving it around through the campus. There's also provision in the plan for common spaces with specifics for a number of the special use rooms. So obviously classrooms will not be used for classes. There will be no in-person classes. But classrooms still could be used for meetings if the social distancing requirements are met and it's less than 10 people. Offices, again, can be used, but it's no students in the offices, no guests, unless, again, you can maintain social distancing. Meeting spaces have to maintain it, and then there are plans for all the specific spaces. I won't go through them, but they are in the individual plans. And just so you know that that's here, if you have questions about specific spaces, go look in the plan. You'll find them in detail in there. Washrooms, this is the most commonly sought space in any building. We are going to try to de-densify them again. And what this really means is reducing the number of stalls or urinals so that everyone is always able to maintain 6 feet of distance. In some of the smaller washrooms, and I've got a picture here of Prince Hall, none of these washrooms are capable of maintaining 6 feet of distance. So these will all be converted to single washrooms, both on this floor and on the classroom level below. We will be changing the hardware on the doors so that they will be like saloon style doors. The one in the middle there is accessible. There's a button you can press and the door opens. The other ones will be saloon style doors so that you can, use your elbow to move through without touching anything. And the stall inside will have a lock on it, as they always do. And the gender will no longer be specified. So all of these washrooms will be gender non-specified. And that is because when students come back, these washrooms will be heavily used, the most heavily used, and we really only want one person in there at a time. Oh, and another thing, pardon me, is that other washrooms through campus will be having upgrades to the hardware as time and money allows us to do this. So this is touchless faucets and possibly towel dispensers and soap dispensers. It takes us time to actually buy these things. We're finding it's really difficult to get them, and it's going to take us time to install them. So again, starting with the most used washrooms like the Prince Hall ones, and then moving through campus, we'll slowly upgrade. Obviously, physical barriers, you'll be seeing lots of these throughout Prince Hall and other areas. Here's just 2 examples. If you have requirements for these, please put in micromain requests to facilities management. We'd be happy to provide them. And if you tell us earlier rather than later, it's very helpful because we're trying to plan for how much materials we need to buy. Plexiglass is under high demand. The price has tripled. The more planning we do, the better. So if you can tell us if you need something, let us know, and we'll help out. Contact tracing and communication of a COVID-19 infection. So right now, the department and programs, everyone and the units, everyone in their individual plans has a section for screening and some provision for contact tracing. So this means that we need to make sure that everyone knows before you come to campus, if you feel sick, please don't come. Follow 811. If you're sick while you are in campus, immediately self-isolate and try to get home as quickly as you can and follow the authorities. And it's important that we keep some record of who's been coming and going as best we can. And it's been left up to the individual departments and units and programs to have methods by which they'll do that. Because if someone does get infected with COVID-19, the health authority will probably want to know, obviously, who's everyone you've been in contact with. And our ability to go back a week or 2 in the past and be able to have some notion of perhaps the other people who might have been in a similar space and make sure that they are contacted for testing, that could be really important information. So we want to make sure that we're aware that we need to do screening and keep track of who's in place at particular times. I say it's spelled contact wrong. Contract is to say contact, not contract tracing. And if someone does have COVID-19, the communication will be provided by the university, but as prescribed by Public Health and the Nova Scotia Health Authority. It's important that we listen to and comply with what the nurses and doctors who are professionals tell us to do around any kind of potential infection exposure. So if we're informed by public health that someone was infected, we will then ask them, what is the best way to go about communicating this? How should we communicate the risk? And that is to both respect people's privacy and at the same time to provide everyone with the most information that they could possibly have to ensure that they're safe. So if we have the contact tracing in place, hopefully it will be a fairly straightforward exercise that if someone does have COVID-19, we'll be able to get everyone who's been in contact with them tested. And the way that will happen is that a nurse from the Nova Scotia Health Authority will contact those people. It won't be King's contacting you to tell you get tested. It will be the health authority saying, we know you've been in contact with someone with COVID-19, just like if you were in a superstore or something, you should go get tested. So this is an important point to note because we have to make sure that we respect each other's privacy, but at the same time keep each other safe. And again, last here, accountability. So really, we all need to be held personally accountable for violations on the safety plans. Again, I've used that icon of all the hands together in this because the point of this is not to be punitive. It is always to help educate and bring everyone along together to help. Because again, unlike ever before, we depend on others for our safety. it's unlikely that necessarily my behavior might affect me. My behavior might affect you, and I need to be held accountable for that. And by following the safety plans, obviously, I'm doing the best I possibly could to keep you safe, and vice versa. Um, so if there's incidents where there's gross or negligent violation of the safety plans, there is provisions for employees. All of us who are employees of the university are subject to discipline, just as per any other safety violation that could happen. And students are subject to the student code of conduct, which is different, but also an area where they need to be held accountable. But I really want to emphasize that it is, if we get into a point where we're policing this as opposed to cooperating, we will have sort of already failed. We need to understand that being accountable for this is really about caring for ourselves and caring for our neighbor. And if, for example, I make a mistake and I get a little bit too close to you and I fail to social distance, you can say, Ian, you're getting a little bit too close. And the right answer from my perspective is to say, oh, thank you. And then I step away. That's all it needs to be. And if all of us have that attitude together and we're working together like that, knowing that anyone who might be correcting us is just trying to make everyone safer, hopefully we can avoid anything more than that kind of interaction. And also to be compassionate with each other. We all find COVID distressing, and none of us are experts in infectious control. So we're all learning as we go. We need to also have compassion for that and help train each other and teach each other, the new social norm. All right, so just to wrap it up. So the point of why we're doing all this, the point of all of this is incremental change at the university towards a positive end. And none of us like COVID. None of us want to be here. None of us want to have this experience, but we are here and we are in the middle of a pandemic. But there are ways in which we can make things better for ourselves. And the way to do that is through good safety planning and then follow through. So I'll finish on this slide before I go to questions here. Remember this slide. Really talk to each other. Remember, you need to be trained and sign off on your plan, and start having those regular safety meetings every week or every 2 weeks, talking about near misses, sharing information, and talking about how you're going to resolve past items. Does anyone have any questions? If you do, you may be muted right now because I cannot hear anyone.
I'm muted. It's Charlene. There was just a couple of things we spoke about. Can you hear me?
Yes.
Okay, perfect. When you said Prince Hall Breezeway, you said there were 6 washrooms. I think Tammy helped us figure it out, but you meant that in terms of the stalls, is that what you meant in the breezeway, that there were 6 washrooms?
So if you think right now, there are there are 3 doorways to washrooms, right next to the dining hall. And if you go 1 floor below, like opposite the wardroom, there are 3 more doors. So there is a total of 6 washrooms currently existing in that area. Those 6 will be converted to essentially single-person washrooms. The ones in the middle currently they're accessible washrooms. They just have a single toilet. That's all they are. The other ones have 2 toilets and a urinal in the case of the men's. They will be reduced just to single toilet washrooms. So in other words, only one person will be able to use any one of those washrooms at a time.
So how will you know if someone's in the ones that have more than 1 stall?
It is going to be slightly awkward in that sense. We had originally talked about locking them. However, there was a lot of concerns about locking and safety of people in those washrooms during that kind of situation. So if you're in the room, you still have a lot of privacy. There's a lock on the stall still. So if you're currently in a washroom and there are 2 stalls, someone may come in the washroom with you, but they're going to see that the stall is locked, and hopefully they will turn around and leave.
But my last question was, in the document it said there could only be 1 person in an office at a time, and I think our office figured it out. This morning we were talking before the meeting, but I think it's important to let everyone know that we felt that in the document you meant a confined office, as opposed to the student accounts bursar's office or registrar's office, where you could have more than 1 person in the office. Is that what you meant?
Yes. Yeah, so lowercase o office. Yes. So this is an office in the sense of a room that's intended for a single person to do their job, as opposed to the office of the bursar or the office of the registrar. Yes, thank you. That's a good clarification.
Thanks, Ian. That was it.
Anyone else have any questions or areas that they want expansion?
I asked Dorota here. Hi.
Hi.
I would like to have clarity how I should communicate all of this to the faculty in contemporary studies, and what my duties are and how I can, go about them.
Okay.
As of today, right? I'd like to, because people are beginning to come to campus. I had to come in. I'm speaking from my office.
Okay. Yep. So that's a good question. So many people have not had the experience before of doing safety training or safety planning. And first of all, everyone's done a really great job knowing that that's the case. So normally the way that we would do this is that we'd have supervisors or leaders, maybe Dorota like yourself, take the initiative to set up a meeting, and then I am happy to assist you in putting together the content for that. I can provide, blank templates for PowerPoints. I can attend and be your sidekick. Whatever you want me to do, I'm definitely willing to help out. And realistically, the training, all it really means is just reading through the plan that you have and making sure everyone understands it and talks about it. If there's any questions or input, it's a great opportunity. It sort of becomes your first safety meeting. And then you continue to roll from there.
Wonderful. I understand that there are actual physical signatures, right, that people have to put on some kind of form. I saw that before. Could you just let me know what the timeline, because for people to put their signatures on it, I don't want it to be just, oh, whatever, I'm signing. I would like them to know what they are signing.
Thank you. I appreciate that. That's good. Yep. So right now, we're not putting a super strict deadline on anyone who is working from home because obviously your risk right now is very low. But if you are planning to come to campus, you need to be trained in short order and you should be signing soon. Um, at this point, the next meeting of the Occupational Health and Safety Committee is in about 3 weeks. And at that point, it's a little less now, actually 2 weeks from now. So we'll be doing a review of people's progress at that point. If you are at all able to have everyone trained by that point, it would be ideal. I understand that some people may not be possible. Perhaps they're away, they're somewhere else. However, we're not going to return people's normal key card access to them until they have been signed off under a safety plan. So people who do not get trained in the interim will need to eventually be trained if they want to have access back into the buildings. And the notion there is that really, the buildings are our communal fortress. Before we're going to let you back in the fortress, we want to make sure that you know how to be safe when you're inside it. So that's sort of the together.